Yeah. All right. Perfect. Also, so now from this moment on, everyone is being recorded. This will be posted on sort of my YouTube channel. Again, to kind of catch everyone up, I have Dr. Krause, who's a neurologist, specialist training in movement disorder, which largely, again, sort of treats Parkinson's disease. So here we have some objectives, and then I'll go ahead and move forward here. And then, Erik, please feel free to jump in and add anything to any parts of this, please. So,
yeah, if you want, I could just jump into it if you want me to just start.
Yeah, sure. Or if you want to, yeah, go into some brain basics. What's the brain? What does the brain do?
Yeah. So, gosh, what a great slide to start with. What does the brain do? Okay. So, how many hours do we have?
I think you gave me one, but we have as long as you have. So.
Okay, perfect. I'm not going to bore you with like all these huge scientific terms. I think the goal today is the KISS method. Keep it simple, stupid. The brain basics. So I think even just that title kind of misleads us because we think of obviously everything to the brain. You know, this is the central and a peripheral nervous system. This is not just the brain. And with that goes your enteric nervous system or your gut-brain axis, which I think we often overlook as well, because you have a higher density of neurons or brain cells even in the gut compared to your brain. And so, you know, that connection is via the spinal cord and some of the peripheral nerves and some of the cranial nerves that end up communicating between the two. And sometimes even there's theories that a lot of these neurodegenerative disorders, such as Parkinson's in particular, which obviously I know the most about, but that gut-brain axis plays a huge role in the development of Parkinson's, and people actually have hypothesized that Parkinson's starts from your gut. So that same principle kind of applies for any neurodegenerative disorder where not only are we thinking about the brain because it's all memory and cognitive issues, which we're focusing on today, but you have to wonder how that interplays with our gut. And so that's kind of a nice little teaser for what we'll talk about in the future here. Talking about the brain itself, it's divided into two large lobes, and then you have the primitive brainstem and cerebellum that sits below the lobes. And as you get closer to the periphery of the brain lobes, you start to get into the higher order functions. So you have here the frontal lobe, the parietal lobe, all the lobes. And then below that, you say these are all subcortical structures, and those are more of the connections as opposed to the cell bodies. And so when you're looking at the lobes, you have a high propensity of neurons and cellular glia and all these other supportive tissue matter up towards the top, and that's where your cognition is affected. But also you have to understand that that's not where everything is, and it's a complex interplay of not only neurons and connections with the axons, which are communicating these signals. So you have to understand it's a network system. It's not just, oh my gosh, you know, for instance, if I had a stroke in one particular part of the brain, yeah, it might leave me with weakness on one side of the body, but it can also cause like speech difficulties or something else that you wouldn't really expect in that one location because there's maybe a connection that interplays with another part of the brain. And so that's why it's important to always remember that not everything is as simple as this one part of the brain is your memory. I mean, you can get memory loss from a lesion or a stroke somewhere even below those hemispheres. So very important. The neurons are high energy utilization. You know, it consumes a lot of your glucose. And then we have this thing called the blood-brain barrier, which kind of separates the central nervous system from the actual blood supply that we have, and it helps filter what's toxic and what we need through that barrier. So that's an important evolutionary factor that we have. And with that barrier that we have, you know, research is being done to how can we institute certain medicines to break that barrier to get to the places we need to. And that's kind of one of the big drawbacks to how we treat Alzheimer's and some of these conditions, because we can't get everything right to the brain. You know, everything has to get filtered. Say, for instance, you take a pill, things have to go through your GI system, have to get absorbed correctly, get in the blood system, and then make it to the blood-brain barrier. So for instance, when we give medicines for Parkinson's, you assume everything just gets in, but in reality, you would probably expect maybe 50 to 75% of that medicine to actually get to the brain. one of these concepts of neuroplasticity, I think gets thrown out a lot, which I love the term, and I think it's a very non-specific term, but it rings true to the fact that the brain is an ever-changing thing where you can grow new cells, you can grow new connections as you create memories or create certain learning tasks, or basically it's like exercise for your brain. You know, when you build muscle, you build more muscle and more connections and higher more muscle fibers. Same thing can happen with neuroplasticity in the brain. So that's why recovering from strokes and some of the lifestyle modifications that we can employ are very important, because we don't have meds that just create new connections or new cells. We aren't there yet unless we start to talk about stem cells. And then the last thing here is the reserve, which I think is important. We'll probably touch on this later, but cognitive reserve is something that basically means that as you've grown and you've gone through education, or maybe genetically you've created maybe like an educational system to where you had a PhD, or you can speak several languages, or you have certain tasks or exercises or skills that you can provide that creates more cognitive quote unquote reserve, and that helps shield you from brain damage in the future. So I think that's maybe why that was put there, just to kind of give you an idea that some people are a little more immune to memory loss compared to others based on environmental factors or educational or genetics or race or sex or some of these other things.
Yeah, no, that's great. And the only other reason I put that high energy utilization is maybe to talk about how important maybe your own metabolic health is in brain health, because we don't make that connection all the time. We think of our brain as sort of this separate organ, maybe that's not affected, or there was even an idea that the brain doesn't need insulin for action, but then we sort of see the brain responds to insulin resistance in a unique way also. So that's what sort of that was about.
And I think it's important to note also that we don't know all this stuff. You know, this is all this is a learning curve, and we have to practice humility when it comes to things that change the course of history with treatments and anatomy and physiology that we learn as we go along. And, you know, for instance, like some of the Alzheimer's pathology that we tend to know and we tend to think is all true, you know, some of these things have come to be not so true, you know, and there's always a learning curve with all this. So, you know, keep an open mind with all these things. I think that's really important.
Yep. Yeah. Sort of do what we can, but then, yeah, a lot is sort of unknown, and who knows what we'll regret now 50 years from now. So
totally.
Yeah. And I think, again, just on that, on mindsets, I'll say, you know, one of the things I really think of as a great expert is someone who can sort of acknowledge that they may be wrong. So just a shout out to you for acknowledging that too. So
I don't know if you want me to take the lead or if you want to talk about this.
I mean, I guess I'll sort of say what I meant by this. I mean, I think neurodegeneration, I think the first reason I wanted to put that term instead of maybe dementia or Parkinson's or something of that nature, right, is that I personally feel that even though we haven't maybe unlocked this and totally don't understand even close to what I hope one day we will, you know, I think there's a lot of kind of similar factors driving all of these, and then each individual will sort of manifest, you know, let's say one specific form of neurodegeneration. So I'm not implying that everyone has, you know, Alzheimer's and vascular dementia and Parkinson's all together, right? I'm saying that there's some root causes that sort of, and then each individual is going to maybe, you know, display this disease, and then we call it whatever, you know, based on how it's portrayed, you know, how the symptoms you have as an individual. But I think, you know, one of the important parts of this is to focus on that, you know, kind of that the root, let's say, kind of cause of all of this. I think there is a root cause as sort of the point of maybe me using that language. So I don't know what you would reply to that, but go ahead. Yep.
Yeah, I think that's a great lead in and a segue to the fact that if you look under a brain, under an autopsy of a 75-year-old who happened to pass from like a heart attack or something, you will probably find some of these accumulated proteins that we like to kind of call dementia. You know, if you did if you looked under the microscope of one of these people, you'll see tau or you'll see amyloid. And now you kind of say, well, geez, did they have Alzheimer's this whole time? He never expressed any symptoms of that. And so you have to kind of wonder if this is more of like a spectrum of disease where now that you've maybe, for instance, I'll use like Parkinson's, for example. you've basically, the first time you express symptoms of Parkinson's, which is like tremor, slowness, or falls or something like that, you've already lost 80% of your dopamine producing cells, and you've already lost a good majority of some of the or you've already kind of gained pathology through the years. So now you've started phenotypically or kind of clinically starting to show the symptoms based on that. But you might have had Parkinson's kind of like lingering for the last 5 years or 20 years for that matter. And so you have to wonder like the spectrum of actual disease versus having pathology, and then the other thing is that we're starting to find out that, like Parkinson's and Alzheimer's, or pick your neurodegenerative disorder, might have overlap. You might look under a Parkinson's brain under the microscope and see tau, or see findings that are consistent with an Alzheimer's brain too. So you have to wonder the spectrum, the overlap, the cross-reactivity of like maybe certain genes being turned on by certain environmental factors. There's so many different things that you have to wonder that, for instance, everyone kind of says, well, my dad didn't have Parkinson's, so I won't get it, right? And it's like, no, it's not necessarily a genetic thing. And same thing with Alzheimer's. It's actually not common to be genetic. Now, if you had a father with Alzheimer's, you might be at a higher risk, but that doesn't mean that you're definitely going to get it. And so there's this theory that there's a multi-hit hypothesis where it's not just genetics, it's not just living in a polluted area, or it's not just being obese or not being educated that leads you to Alzheimer's. It's probably a combination of these things. And then on top of that, to get even more complicated, maybe certain things like viruses turn on certain genes or activate certain pathologies that go well beyond our traditional understanding of some of this. So I think it's so complicated, and there's so much overlap that it's, us as doctors and in the scientific community like to box things into these categories, but you have to kind of think outside of that and wonder if there's even two processes going on and not just Parkinson's or not just Alzheimer's.
Yeah, perfect. And I don't have too much to add. That's basically amazing, information. I think huge. I had heard even 50% loss, let's say, of dopamine producing cells, and you're saying 80. So again, just shocking, right? How much reserve we really do have. I think, the positive takeaway for me is that, again, we can control a lot of the stuff that he talked about. Again, you can't control some of the viruses and maybe some of this, right? But again, just taking some power back into our hands and realizing, because I think there has been an attitude of sort of like, well, if this happens, it happens. And, it's sort of just, we have, again, I think there is a bit of this, we don't have control over any of this sort of thing. And yes, of course, like so much that, yes, there is genetic risk. There are a few genetic kind of risk factors we'll jump into here. But again, most of this is really not genetic. A lot of this is risk factor based. So
what does dopamine do?
Dopamine does a lot of different things in the brain. The question was, what does dopamine do? But in specific to Parkinson's disease, there's dopamine loss in a specific part of the brain that really is intricate in movement, really of the body, coordinating movement. Krause, Dr. Krause, if you would expand on that a little bit. Yep. So
I actually love the question because it kind of feeds into this theme that we got going on where it's like, what does dopamine do? Well, guess what? Dopamine's not the whole entire story for Parkinson's. It's also serotonin, acetylcholine, and some of these other neurotransmitters that we don't have to get into. But for dopamine in particular, I think everyone kind of thinks of it as the happy hormone or the happy neurotransmitter, where it's like the reward system. So for instance, everyone kind of relates this to like gambling or something that gives you a reward or some sort of urge to do this, and an addiction, and kind of feeds into that. But it also has several roles in memory, several roles in sleep, have several roles in mood. But primarily when we're talking about Parkinson's, it's how it regulates your movements in a complex interplay within certain structures of the brain. It's very complex to say exactly how it relates in Parkinson's,
right.
but for the most part, it's a dopamine loss that creates the changes in your movements.
And I would say like the general theme that I would say that neuroscience is sort of pointing to is, I think, more of how do certain systems in the brain interact more than maybe specific neurotransmitters, because these systems may use inputs or outputs from multiple neurotransmitters, sort of what he's getting at, right? So some of those specific systems that have been discovered in Parkinson's involve dopamine, but that's not as important as sort of the concept of, it's these systems are not communicating with each other in the same way that they used to, and
Yeah.
don't have the same connections that they used to.
And you kind of liken it to a computer. You know, it's like a computer-based system that you have, but also beyond that, the electrical component with connecting neurons, but also the chemical component with dopamine and some of these neurotransmitters. So again, it's this complex interplay.
Yeah, great. Let's see here. So biomarkers, genetics, and environment. So this is so we talk about a bunch of different neurotransmitters and proteins, as Dr. Krause very accurately said. Again, when you take these autopsies of brains, even in people that didn't have quote unquote brain disease, you see all sorts of different levels of these proteins, and there's a very uncorrelated, basically, with disease. As far as clinically, we don't always see that the proteins correlate with disease. What we see actually a little bit more tracking with is people that have, very poor metabolic health seem to have a much higher rate of deposition, disease progression, let's say. So some specific biomarkers that I would say are important for you to know and therefore track. The saying goes, that which you measure, you manage, right? So if you don't even measure these things, how can you even have a chance? So let's start with some basic things like insulin, glucose, A1C, your blood pressure. Again, some data to suggest homocysteine is something that we can track, especially in folks that might have genetic issues to have that high. And then body composition, I think personally is very important. Kind of, again, the more muscularity we have, that sort of implies a movement reserve. It's sort of a measurement maybe of kind of movement reserve in a way, as well as that metabolic health. Anything else you would add in that category?
No, I love it. I think the biggest thing is, again, the KISS method of keeping it simple here is being a healthy, non-metabolic patient where you're avoiding diabetes, you're avoiding strokes and heart disease, you're avoiding any kind of high cholesterol. So being a healthy human is essentially a big time good lifestyle adjustment to help avoid any kind of neurodegenerative disorder.
My other big thing here is that, some of these things are not apparent just with, let's say, because I didn't put weight on here necessarily. And that's intentional because I think, that's not necessarily, I do believe you can be healthy at a variety of weights, but that has more to do with, again, body composition, right? How much of that is actually muscle? How much of that is body fat? That's probably much more important as it pertains to metabolic health. And again, you measure these things, right? We measure your lipids, your triglycerides, your HDL, and then we make that. I believe that we can make an objective decision. And I think sometimes the trouble is that all of us, myself, I'll put it, included, we have trouble disconnected. Well, I eat a lot of vegetables and I do exercise and etc. And these are your numbers. Well, they're the numbers, and if that's what the numbers say, then that's where I believe that's where risk really tracks. And that, again, you just have to let go of some of that emotional piece is sort of what I'm getting at here, right? Is that, sure, you can feel some way about it and we can talk about how you feel about it. I'm your family doc, so we can talk about that too. but let's also kind of talk about what the numbers really say and mean. That'd be a big message, at least for my patient population personally. Again, measure these things, right? Let's not be afraid of looking at them. Again, especially for my members, this is extremely, affordable actually. And again, insurance maybe doesn't cover some of these specific labs, but none of them are actually that expensive. And so that's another kind of just shout out to kind of direct primary care and what that can help people provide. But again, I just think no matter who your doctor is, you can find independent labs these days. You can advocate for yourself and you can get this information. Even again, if you're not one of our patients, please go ahead and still seek out this information however you feel you can. Again, few genetic things. I don't want to pause too much on this, but because it's just not a hugely important thing, but there is some serious risk associated with especially 2E4 copies as a female. patient, especially. So if you do have kind of early onset Alzheimer's disease, that's what that's specific to. Especially that would be a reason to maybe think about that kind of testing. Again, I believe there are some things you can do because this is not the only reason you'll develop Alzheimer's disease. So knowing that is not necessarily a sentence of, well, you're going to get Alzheimer's and now you know and can't do nothing. That's not, I don't think, the situation. And I think a lot of smart people would agree with me too. So yeah, and then again, I would say that there's, pesticides. This is something that, again, I think there's really good data for, and it's sort of shocking that I think no one really takes any action on this. So, these are banned in Europe and doesn't really get talked about enough. And when it does, it gets sort of no attention. I think I keep forgetting the specific names, maybe rotenone and paraquat or something like that, especially with Parkinson's, and the Parkinson's belt in the Midwest is what I'm aware of. So I don't know if you're aware of anything else there, Dr. Krause. So
those are the big ones. Yeah, you can go into so many different environmental things, but as far as pesticides, I think those are the big ones.
Anything else on genetics? I didn't want to pause too much on that. I really feel like it's pretty minor cause of a lot of those. So
yeah, you know what? I agree with you on the whole, but I actually think it's important too, because say you had a mom with Alzheimer's, and you are kind of sitting here, which is really common as a patient, saying, oh man, you know what? It's weird. I forgot the name of that person I met the other day. And you kind of get in your own head, even though you're a healthy 45-year-old person or something, and you start to say, well, am I getting dementia? My mom had dementia. And I can't tell you how many patients come to me with those questions, even though they're completely fine at work. Nobody else is seeing things. And so I think people honestly get kind of worried about that, rightfully so, when you have a direct family member who's struggled with it. And so doing genetics and doing any kind of laboratory testing for the risk of Parkinson's, which includes cerebral spinal fluid testing, which is a lumbar puncture, which nobody likes to do, but you can get good information out of these things, and it's helpful for the predictive value. But if you really wanted to do genetic testing, I actually do think it's important, because if you were to do genetic testing and pop up positive and you say, well, geez, I got the ApoE4 gene, you can not only predict what the future holds possibly, but also you can enroll in clinical trials, which is really important. And then also there's new FDA approved medicines, which I don't know if we'll talk about today, but they're a little complex, but sometimes this allows you to be first in line for some of these treatments and also be good candidates before you're not a good candidate. So, I do think it's kind of, it's cost prohibitive. It's kind of hard to find commercially, but I do think there's value in it if you can afford it and find a testing service that's there. And that same goes with a lumbar puncture, getting cerebral spinal fluid. And eventually they'll have a blood test, I'm sure, at some point testing for these, which will be way easier, obviously. And then there's even things like, PET scans, which obviously we're not going into diagnosis, but that's another diagnostic tool, which is not usually commercially available. But either way, I think it's important to know, not only for our own mental health of what to predict and what to know going forward, although some people don't want to know, but also for treatment purposes and planning and family planning for that matter. So.
Yeah, and this testing, E4 testing, is, let's say, around, like, just the one gene is, I think, $50. So just to give people an idea of what it is today here through us. But yeah, some of this stuff can definitely get expensive. And whole genome sequencing does exist out there, but I think it's in the range of, I think I've seen it to be maybe $500 or $600 or something like that. So just to give an idea, Klotho is a protective gene, so that's that one. And then the CR-ORF is more frontotemporal dementia, and ALS, I believe, both are sort of associated with that one. So yeah, exercise and movement. Again, these are things that, again, we have control over. And again, we're discovering all sorts of new stuff. BDNF is a brain chemical that basically promotes brain cell growth. You can grow new brain cells. You can increase, let's say, hippocampal size, has been shown. And I believe like 70 or 80-year-olds, like relatively, again, older folks, we've seen brain growth. So in response to, let's say, again, an exercise program. So that is a really interesting finding, and something that we do have control over, increases that reserve, that movement reserve. And then again, just bolstering that cardiovascular health, right? That's what we see as a huge kind of risk factor here, right? Not just for vascular dementia, right, which is directly caused by poor cardiovascular health, but really all of these neurodegenerative diseases are affected by cardiovascular health, which is again tied to metabolic health. And it's hard to kind of, I think, yes, we have to sort of separate some of this stuff and say, hey, this part of it is important. But I think, again, what you hear both of us saying is that health is health, and it takes all of it. You have to have a healthy mind, you have to have a healthy body, you have to eat a certain way, you have to move a certain way, right? And there's just not really any way about it. That's the way our biology is sort of tied to that, and tied to this planet that goes around the sun, and you need light. And anyway, so that's just, I think, a deeper concept of health. So
I think it's all very good, and I think just a kind of a quick point on just getting overwhelmed with all the risk factors and all the things that we have to do, quote unquote, to avoid dementia. But you also have to listen to your mental health. If you're being a Nazi about eating vegetarian for years, or trying to exercise 6 days a week, which is all awesome, I love it, but if it's consuming you so much to the point where you're getting stressed and anxious about it, well, now you're doing detriment to your mental health, which is also a risk factor. Geez, so I think there's I think Raman can probably vouch for this. It's like balance in life is kind of the key here, while maintaining a healthy balance. You don't have to go overboard with exercise and diet to the point where it's ruling your life. I think you also have to have balance. That's all.
Or just a practical example for recently, people have been sort of guilty with, Halloween candy. It's like, okay, fine. If you're having a couple pieces of candy on Halloween, you're doing great. Okay. If you're not eating candy the rest of the year, right? Or let's say, once a month or whatever, you're doing amazing. Let's acknowledge, you have your, 2, 5, 10 pieces of candy on Halloween. And if that's, again, that's maybe an example of the balance, right? And people will come back and sort of be like, that will be my success, right? If you come back and tell me that is the worst thing you did, then I'm really, really happy. Anyway, so that's just kind of a practical story there on maybe what that looks like. Oral health, so brush your teeth, protect your head, maybe floss occasionally. So again, I think we've started talking about this already. It doesn't matter how old you are or when you're listening to this, go ahead and start now, right? It doesn't matter what you did yesterday, any of that. Today is a perfectly great day to start. That's the biggest message, on prevention, I think personally, and something I think we can all remind ourselves every day. So you can do something, and you can always start today. It doesn't matter what happened before that moment. So again, what are some of those things? I think we've gotten into blood pressure, waist circumference. Again, I said that's a little more associated than weight. Again, you don't see weight on here for me. Again, lipids specifically there, I think ApoB, triglycerides, HDL specifics there, glucose, insulin we've talked about. Nutrition, again, I think, protein intake kind of gets underlooked at its importance in building muscle, and especially in maybe metabolic health. And maintaining muscular strength, and sort of giving you the most you can get out of maybe your movement routine. So if you're under, eating protein there, that often means you're replacing that maybe with other calories that are not as effective at doing those things for you. Important to get these essential fatty acids, omega-3s, which, again, can come through supplements or marine sources. Lots of other, nuts and seeds contain a lot of these things, but there are some that are unique to, I think, marine sources. Creatine, I think, has some interesting evidence to really be, as far as a supplement might go, that, boosts actually brain health, long been known to boost with muscle health. But I think more and more evidence for it to maybe help with brain health. And then the importance of the microbiome, I think Dr. Krause really touched on this earlier, that gut-brain axis, and maybe one of those areas where we know even the least, right? We know very little about all of this, and maybe the least about how that gut-brain axis and the other things that are not human in us, this microbiome, which is not just bacteria, but viruses and fungi, and really a whole bunch of different things in there. So really interesting area, ripe for, I think, both deeper understanding and then hopefully prevention and maybe even treatment of some of these things. what we know for now is if you can eat a diversity of plant fibers, that seems to be better. I don't know that I can make, a really truthful statement outside of that. So more to come there. So sleep, hugely important. This is just, again, I have a whole talk on sleep. I believe that's an hour and a half long. So definitely check that out if you want a little more information there. But prioritize it, I think, is the main thing I could say. It's just no way around it. Essential part of brain health and body health. Let's say all health, really everything, emotional health, everything. So move in new ways, right? So learn new skills, build muscle. This is also deeper, just about not only in brain, this is boosting your metabolism, this is building muscle, this is building more new mitochondria, recycling those old mitochondria, doing so many things that might be tied to just, again, deeper things in health in general. The things that are good for your heart or good for your brain are really good for the rest of the body. Again, you're getting so much. This is not just about brain health, right? This is, if you do some of these things, you will probably have better emotional health. You probably sleep better. You probably have, less joint pain. Be able to tolerate the normal stressors of life, things that come up all the time, every day. And it's all tied together. That's, again, just a huge message and takeaway from this. The importance of maintaining, again, I'll specifically kind of pause on hearing aids. I think there is sort of maybe a lot of people resist getting something like this and feel like, well, it's just, I can't hear, people can just talk louder, whatever. No, again, it's just really tied to the brain needs that sensory stimulation into the brain, right? That's a huge part of keeping your brain healthy. And that's how movement kind of works, right? You're moving and that signals, sort of inward to the brain as well as outward. There's that duality that's sort of important there. And again, that in the cognitive sense is also related to your senses. So if you can maintain, vision in some, reasonable ways, you can maintain hearing with the hearing aid. These are really important things. And if you're doing something, again, that, is high risk for head trauma or learning new skills, that's what I'm sort of getting at here with growth mindsets. Mental health, I'd say just sort of pausing, increasing awe, taking in a lot of, we live in such a beautiful place here in Canyon City. I think about this every day. It's so easy, I feel like, for me now, having lived in sort of really flat places without a lot of natural beauty and a lot of concrete around me. It's been really refreshing to be here and just see, snow-covered mountains, for example, today. Sorry, Erik, so I know that's sort of maybe
it's 80 degrees outside. I'm happy.
So, but anyway, let's get your input here. I'd love to hear some of your kind of pillars of prevention as well. So
I think this is the most important slide of the whole presentation, because we have to remember that we have no treatment for Alzheimer's for the most part, or dementia. Like, nothing is going to reverse your memory loss, period. You can listen to all the infomercials and all the news things that come up in the news that suggest this will help you. You have to take it with a grain of salt, because the most important thing is lifestyle. So with that being said, I think you touched on this appropriately. Hearing aids is, again, so important. Your hearing is a risk factor for dementia. If you can't hear things, you're not inputting a memory. And so it can manifest as something called pseudo-dementia. And pseudo-dementia means, like, you look like you're not really making memories and you're not recalling things. And is that really due to your Alzheimer's or something else? And so another form of pseudo-dementia would be severe depression or anxiety. If you have severe depression or anxiety, your mind is somewhere else. You ain't listening to people when they're trying to talk to you, and so you don't input a memory. And so you frequently have poor attention, poor concentration, and then it manifests as short-term memory loss. And so once that improves, the memory gets better. So that's also another form of pseudo-dementia, and it goes into the fact that it's important to not only limit depression and anxiety as much as possible, which I know is tough nowadays, but trying to keep good mental health is so important. Another thing is the sleep part. Also another form of pseudo-dementia, meaning, like, if you're not sleeping, you ain't paying attention to something someone's telling you. And so, again, you're not inputting a memory. And so it looks like you're not really listening or not making memories, but in reality, you're just so sleepy, you're not paying attention. And so he wrote here, which I think is awesome. I think it's the right amount of time. Prioritize at least 7 hours. But to that point, it has to be a good quality sleep. You know, if you have sleep apnea and you're getting 9 hours of sleep, that ain't very good sleep. You're still going to probably have daytime sleepiness, and that's also a risk factor for Alzheimer's and neurodegenerative disorders. So make sure that you're prioritizing effective sleep as well. So I'd say that on top of this. Last thing, I think that
high quality is
high
the
quality,
term.
good.
Yeah, yes.
Yep. And then the last thing I'd say is probably one of the most overlooked things is being social. You know, I think a lot of people this day and age since COVID have kind of retreated into their comfortable homes or the couch that they like to sit on, because we did that for a year and a half with COVID. Or maybe we were always like that. I don't know. It's just kind of how we're becoming. I can't tell you how many patients sit on their couch watching the news 24/7. I mean, it's insane to me. And so when that happens, I say, look, you're complaining about memory loss, but you're kind of sustaining your own little bubble, you know, with the TV that tells you everything you need to know. And then you cook your meal and you sit back down and you don't do any physical exercise, and let alone talking to people. But socialization when you get older is a tougher thing to do. You know, you have to hear what people are saying. So they have to have good hearing. You have to input that into your brain and then come up with a response to the conversation. You know, so you have so many different moving things that go into that you kind of you take for granted as a healthy human. So when you get older and you're starting to get memory loss, if you retreat, then you're going to accelerate that. But if you become social and stay out there and doing the things you like to do, interacting with people, having to create thoughts and responses to questions and conversation, that keeps you sharp. The other thing on top of that would be brain games. I think maybe just keeping yourself sharp with luminosity is one of these things that you can see. It's one of the apps, or certain apps that are out there. There's plenty of them out there, but lots of games you can do, whether it's word, math, or just even crossword puzzles. Just keeping your brain sharp with those things. It's like exercise for your brain, so it makes sense. You're creating new connections and you're exercising your brain so it doesn't deteriorate as much. So those are probably the big things I'd add to that. And then on diet, I think if you have to really pinpoint a specific diet, you'd probably go with the Mediterranean diet as the most studied and best. But diet studies stink. Just remember that. There's not really good controlled trials on these. And we kind of glean what we can from retrospectively looking back on people who adhere to a diet, which is not great data. But I think the most part is limiting carbs, limiting sugars. Fats are okay, so certain fats are fine. But really maximizing your vegetables, olive oil based, and fruits, and then white meat is probably the big things. So that's probably the stuff I would touch on that I see a lot in my real world practice. That I can't tell you how many people come in with perceived memory loss, but in reality just don't sleep really well. And once you improve their sleep, they come back and they're like, you know what, I'm way better now. It's kind of a phenomenal thing that you just don't think of.
The other thing I was shocked listening to some of the, this was specifically, I think, on Peter Attia's podcast, but one of the neurologists on there was saying that they've seen memory improvement with the improvement of lipids as well, which I found kind of surprising. So I didn't know if you've ever seen that clinically as far as like reversal of lipids, or let's say, I've definitely seen it with diabetes. I'll say definitely huge kind of dementia that I've seen with, really bad diabetes, whether it's type 1 or type 2, doesn't matter. But I was wondering if you see anything with lipids.
Oh, there's definitely data on that that supports that thought. You have to really dive into the particulars of it though, like polyunsaturated fats, maybe, certain types of lipids, there's so many types. You have to kind of hone in on the exact, type and study and how much the intake was. So I think that's a general topic that we're still learning about and we don't really know the details about, but there's truth to that for sure.
Gotcha. Yeah. And again, that's sort of, thank you for putting in that specific pause on social connection, because I did put connection in there, but that's what I sort of meant. But again, if you guys have done an annual with me, that I ask about social kind of health as one of the main pillars of health. So again, really excited to hear you sort of put that in there as a pillar of prevention as well.
And I think, even just like your quick second on meditation and prayer. I mean, just centering yourself in general, just kind of reflecting on life. And I think as a fast-paced American society, we kind of neglect the like you said, the common beauty that we have and the reflections that we should have. We just kind of live day to day. We don't really input certain like diary memories that we used to back in the day, you know. So I think that's something that's neglected as well.
Yeah, so Arthur Brooks, this is kind of my mental health talk, but Arthur Brooks talks about the macronutrients of happiness, right, as sort of enjoyment, which is making memories with people, is sort of his definition of that, right? So sort of just going back to this is even maybe evidence-based, right? He really tries to, Arthur Brooks is one of these people that's trying to make sort of quote unquote happiness as evidence-based as possible. So anyway, so that's what he would say. So anyway, it sort of reflects, I think, what we're saying as well. Treatments here. So again, I think we've really hit on the last slide, right, is so important. Once you've gotten to this part, you know, as far as kind of really disease specific treatments, it just doesn't really look that great. There are some meds there that are specific to some of these diseases that have, you know, again, FDA approvals and, you know, at least have good safety data and some of that type of stuff. But again, a lot of side effects is one of the main reasons I think people stop. And again, the effectiveness, I give people kind of the rule of thirds on a lot of this. A third of people are going to stop because they have side effects. A third of people, this is specific to dementia medicines, a third of people are going to stop because it doesn't seem to help anything. And a third of people might have some benefit, which is basically keeping you where you are for a little longer. Parkinson's, I think there's a little bit more in the treatment world. I do think, you know, people respond to treatments here in a little more meaningful way. But again, just careful of scams, right? It's just, there's not really a lot out there in the treatment world. I'll let you expand there, Dr. Krause.
Yeah, so I'll give you my personal opinion. This is not something that I don't think you put 10 neurologists in a room. I love this metaphor, and you have a dementia patient who's maybe mid-stage of dementia. All 10 of those neurologists probably have a different opinion on how to manage that person. My personal opinion on these drugs, especially the donepezils and memetines of the world, they're relatively safe. You know, they don't really come with many side effects. Donepezil may be a little more GI side effects, but for the most part, they're very safe. And the key here is to use it early. If somebody's already gotten really demented, these medicines will not touch them. And another thing that you have to understand is your expectations. These medicines do not cure or slow the disease. Everyone ends up being in the same spot when this is all said and done. I think the last thing I'll touch on is the Parkinson's treatments. You know, that Parkinson's is treatable. Obviously, there's nothing that cures it yet, but it's treatable. We can give people good quality of life with medicines. Some of the new medicines out there for memory loss or dementia are IV treatments that have come out in the last couple of years, although under fire with the FDA and some of these, there's some controversy with them. These are the medicines that are in monoclonal antibody treatments, and they're IV treatments. You have to go to a specialized center for it. Medicare's not paying for it yet. You have to get regular lumbar punctures, regular MRIs. So it's not only is it a hassle to do all of it, it's expensive. You have to find the right spot to do it, and you have to be the right candidate, which means early to mid dementia. And it's a lot of work to get these medicines, but you know, they actually do have some decent data, as long as you find the right place that gives it to you. And those are available out there. And I think they're just kind of still settling into where the cost and effectiveness are being worked out. So I think there's still more to come with that, but there's some insight and some treatments coming forward. The other thing is that we talked about the lifestyle stuff. Last thing is scams. I think one of the biggest questions I get is Prevagen. Hopefully people are familiar with Prevagen, but it's an infomercial that comes on all the time, and usually during Wheel of Fortune or some of these shows that they know how to market to. Prevagen is fine. It's safe. It's fine. But there's absolutely no data to support its use as far as slowing down any kind of dementia or even long-term cognitive benefits. So I just want to make that clear. I mean, when people ask me about Prevagen, I say, sure, go for it. It doesn't hurt. But for the most part, you have to understand the expectations of it. That's all.
There's been some maybe like light therapies I've heard about for dementia, you know, kind of like flashing lights basically sort of into the eyes. Have you ever seen this like red light therapy being used for dementia at all?
Yeah, light therapy light therapy hits all the conditions neurologically. It seems like to be a hot topic for a lot of these conditions. And there's some like really preliminary data maybe supporting its use, but you have to, again, kind of wonder about the place that's doing the light therapy and what kind of study are they basing this off of, and how much light therapy is the right one for me. And if I have
Right.
seizures, is this going to be okay? So I think you have to kind of take it with a grain of salt still. I was going to say another thing, but I kind of forgot. Might come back to me, but yeah, light therapy is one of those things that we're still not completely sure. Oh, hyperbaric oxygen chambers. There's some data with that. Yeah,
With
but
like traumatic brain injury, I think specifically, it seemed like maybe it was helpful. Yeah,
even memory loss, there's some data. It's just the finding of a hyperbaric oxygen chamber is kind of tough. And you'll find in the scams of, hey, pay us $5,000 a month and we can get you healthy again. And it's like, well, is that really worth my money to get maybe a 1% benefit? You know, you have to kind of understand the realistic expectations of that. The other thing I think that's important is to talk about trials. There are so many trials out there for this stuff. And obviously, I think the Alzheimer's Association is a great website. If you ever have questions about any of this stuff, I would highly recommend it, even for caregivers. But you can find a trial probably near you. I mean, obviously, Denver, Colorado Springs, some of these places probably have some of these trials. And, you know,
Sure.
one of the benefits of it is usually they're free. And the other thing is you get all your testing paid for. So if you were curious about getting a PET scan or a lumbar puncture, but you didn't want to pay the money, enroll in a trial. Everything's paid for, and then they'll do all that stuff for you.
Got one question here. So
Yeah.
Alzheimer's Association. So alz.org, I believe, is their website. I think I have it at the end of the presentation. So, and then Kurt, I missed maybe a question from you.
Clotho and
Okay.
one other BDNF.
Okay. Yeah. Brain derived neurotropic factor.
One question though, for me, I haven't seen a mention of like MS, which I always thought.
Sure. Well, so
my mom had that, and so it's just something I try to keep.
I didn't know if you heard the question, Eric, but it was basically about multiple sclerosis, MS. So I would say it's sort of maybe slightly in the category, but it seems to be a little more autoimmune, involved than, let's say, traditionally what I'm putting under this umbrella sort of. Yeah, again, and is the immune system involved in the rest of these diseases? Absolutely. Yeah. So, but then again, that's the hard thing with, are you a lumper or are you a splitter, sort of thing is in science, to steal a term, so I think, sure, you could maybe kind of consider it that, but I would say it's a little more maybe under the autoimmune umbrella.
And MS might not advance too. There's different forms of MS. You might have a relapse remitting, you might have a progressive, you might have one attack your whole life. And then MS can lead to dementia. So kind of tying that into what we're talking about today, it can lead to that. But for the most part, it's not necessarily related to neurodegenerative disorders per se. It's a little different concept though.
Yeah. And what I mean here, set up life for safety, and this is really, pause on a practical thing here. A lot of us will either be, or if we're not ourselves, maybe live with a loved one, that have something like this come up. And just thinking, I think a little bit of acceptance really goes a long way. I think there's a lot of struggle around, there's some idea that maybe they'll go back to some sort of way. And again, do your due diligence. We talked about here so many reversible things, right? So if they're sleeping okay, you've tried to get them active, you're getting them sunlight, et cetera, et cetera. The other things you can do is, maybe don't have a bunch of rugs around that they can trip on, or maybe don't allow this person to live in a multi-story home where the bedroom is upstairs and they have to take the stairs every single day in order to feed themselves and do essential things. Can they feed themselves? There's a lot of, I think, humility, again, to use a word that Dr. Krause also used earlier, and letting go of that independence. Yes, I mean, I think that's a huge part of this. You have to accept that the patient has to sort of accept that they and again, do they even have the ability? Sometimes I think people even lose that cognitive ability to even accept that this has happened to them. So then the caregiver is sort of forced now to live with that, and just acknowledging how hard this is and how much this can wreck relationships and make that end of life hard for people. And it's nobody's fault, I guess, is what I'm trying to say. This happens, and that person has been taken away. They're no longer the same person. They have a different brain. They're a different person.
I actually love that statement.
Yeah.
I think that's perfect, because it's like a lot of patients want to blame themselves for getting their disease, and it's like it's no one's fault. You got dementia because of dumb luck, or you lived in a polluted area, or you had a gene, or who knows. It's not like you can beat yourself up over getting something like this. And the other thing that I think we forgot to mention, just as far as cognition, we all think of memory as like the main thing, with dementia. And it's not just memory, it's even word finding difficulties, multitasking, processing speed, visualization, or even memory with like working memory and tasks. Or so there's so many different things that go into cognition, and it's not just memory. And when we think of memory loss, it's usually short-term memory. So you might say like, I talked to my friend Luke, and Luke he can remember everything from back in the day, but when he starts to talk about what he had for lunch yesterday, he has no idea. So it's like the short-term memory is what's affected, not the long-term. And I think that confuses people sometimes, because he remembers everything back in the day. He doesn't have memory loss. And it's like, well, let's see what he thinks about this from yesterday, and they might not remember. So I think that confuses people a lot.
Another question here.
Well, it's just a comment. You touched
Yep.
very briefly on personality change, and I think that can go along with the blame. I just lost my sister last month, and she started becoming paranoid and even physically aggressive.
Sure.
That's not her.
Right.
And the people around who were caring for her understood it perfectly well because they were professionals, but it's shocking.
Yeah. So just a personal story there about, again, loss of a sister. I'm so sorry for your loss there. But again, so this person basically became a different person, was more violent and sort of rude, it sounds like, generally, and paranoid. So again, very common characteristics. I would say those exact, kind of characteristics are seen in, a huge number of folks. And again, just remembering that we're not alone, is maybe a part of this too, right? That connection, that tying that back to that social connection. There are support groups around this, similar to, say, whatever, Al-Anon and this and that, right? There are dementia groups that sort of, support people that are living with loved ones with dementia. There are books on this matter as well, talking about how to live with, again, in sort of reasonable ways. I think, here's where, I'll even make a little plug for just spiritual health, in a way, which can provide some comfort here, I think, knowing that, again, that maybe there is something greater than us, and having a connection to that. And yes, again, that's this, it sucks. It's sort of people die before they die, right? They're breathing and walking around in front of you, but they're not the same person they were before. I don't know how else to put it. It's really hard. And I can't imagine, again, how it is for each person. It's just amazingly difficult, I think, to deal with, especially for the loved ones around them. But I personally think, I'll make a plug for families. Again, this is the circle of life, right? The more that I feel that, families can take some of this burden, it does. I personally just feel sort of troubled by how much we stick people in homes and sort of pretend like they're not our problem, sort of thing. Anyway, that's maybe more cultural for me too. But anyway, I really, my heart goes out to families that have to deal with people, and I just really want to make a shout out to those folks out there that are dealing with, keep going. You're doing great work. Everybody needs you, doing hard work out there for all of us. So. Yeah, question.
So I've often wondered how aware people with different forms of dementia are that they have dementia.
Perfect question.
Yeah, go for it.
I love that question. And that's a huge red flag to me. If somebody comes in and says, "Hey, doc, I'm worried about my memory," It's a little bit of a red flag to me because it's like usually patients don't have as much insight to their own memory loss. So to your question, yeah, you're exactly right. Most people, it's almost like Groundhog Day, or even just the fact that it often even causes conflict with the significant other, because they might they'll show up at the neurologist's office and they'll say, I don't know why I'm here. My wife told me to come here. And then that it's very common. And then the significant other will say, no, like, remember when you forgot this? Oh, that was just that one time. And it's just it can actually create that conflict. So yes, you're exactly right. A lot of times there's either denial because they're just oblivious to it, or denial because they're actually wanting to deny the reality of it.
Yeah, go ahead. Questions. We're basically at questions, so here.
My sister went through the stages or phases and profound dementia. Even to the last week, she was quite aware of what was going on, even though she was trapped in her brain. It was evident.
Yeah. So I think it's all across the board. So, this person's experience was that they were very aware of their own dementia. I mean, that definitely happens, but I think, what Erik is saying, that often it is, the case that the person is minimally aware, or sort of minimizes, I'd say that's kind of, to me, is a sort of in that classic Alzheimer's category, right? Of sort of, they try to explain their way around it, sort of thing. Confabulation, you might call that sort of thing, is again, kind of in. Yeah.
And I think, to that question, I do think that most people do know, once they have been kind of accepting of the diagnosis, that something's wrong with me. They might not be able to say it all the time that it's my memory, but I'll often say to the patient when they show up at the clinic for a follow-up, I'll say, hey, why are you here today? Any issues? And most of the time they'll say, no issues. And I'm here for my checkup. It's kind of a vague description of why they're here. When you start to prod a little bit and you say, well, is your memory okay? And how's that been? Oh, yeah. That thing, it's like they will have some insight into their own condition if you prompt it. For the most part, though, they know something's wrong with them. I'll say that. But to everyone's so different, though. To your story of your sister or whoever that was, everyone's so different in their journey that it's so hard to compare this person to that person, because there's so many forms of dementia. You could talk about at least 6 different forms of dementia just off the bat. And so maybe they behave differently because of that form of dementia, or maybe they were exposed to a medicine that made them more confused, or there's so many different factors to why someone's different than the other.
Yeah, just referring to my personal experience, that she was extremely advanced in her stages. It wasn't subtle.
Sure.
Yeah.
So again, I think just to really summarize what I think, hopefully everyone has taken away, that, this is a preventable disease. There's a lot of parts that are not. Sure, let's acknowledge that too. But I think, I'm really trying to focus on what people can do. And so that's why this slide really says prevention is possible and key, right? So know the other things, though. Know your numbers, right? Some of those things are not within your control necessarily, right? You may have really high lipids. I've shared with many of you that myself is, in that category. I lost 40 pounds and my lipids went up, right? ApoB went up. So again, some of this is genetic, but know your numbers. Know what you can do. Know what you're willing to do. Know the things, the exercise is great for lowering blood pressure and waist circumference, and maybe helping your lipids, and building muscle and having movement reserve. And so again, know that one of these tools can do a lot of things, and it's just making that a goal and making that something that's important to you. So again, be active, prioritize that sleep, eat some real food, not, things that are not, have 10 ingredients, 15 ingredients and come in a bag. That can be a part of your diet, but is that what you eat 80% of the time? That's what I'm after here, right? What are you doing 80-90% of the time? Eat your Halloween candy, go out to, pizza or whatever every once in a while. I think everyone deserves to do that as a part of managing stress and being a human being. But that's not an excuse to never, eat vegetables because I just don't like it. Well, you can do that. Just know that then again, that has certain consequences. And I think there's really good science for that, and really good, again, it's difficult, but you can do it, is the message. Social connection, again, gets really overlooked, just how important that is. Thanks again for being here and providing me that connection with a colleague here, and sort of demonstrating that as well, how important that is. And our lives, our careers, all parts of our lives, whether that's at home, whether that's professionally, again, just out with random strangers, right? It really all makes a difference. And again, there are treatments, and there's a lot of stuff that, again, hopefully will be coming out. Right? A lot of research dollars, at least, are going into this. I can tell you that much. But again, part of what you can do now, right, is also accepting this and just realizing it is hard, and maybe again, as caregivers especially, right, just making sure that you yourself are emotionally balanced and realize that this is not the same person maybe you loved years ago. And I just really believe that that's the truth, that they're a different person. So I don't know what else you would add as far as kind of wrapping up here.
No, I don't have much to add. I appreciate the time and having me and speaking on social connections. Me and Dr. Rahman have had social connections for over 20 years now. We've maintained it, which is pretty phenomenal, growing up together. So I really appreciate you as a friend and as a colleague.
Yeah.
Can I ask you really
Back at you.
specific questions?
Yeah, sure. We got another question here. Sure.
Early in the talk,
And then do let me know if you have to go, Dr. Krause. We want to respect your time. So just let us know if you need to sign off.
really quick.
Yeah.
You mentioned something was more prevalent in the gut than in the brain.
Oh, so yeah, I believe he said there was more neuron density in the gut than the brain. I think that's the way you termed it, but I can't remember exactly what you said.
Yeah, that's how I said it. Yeah.
And then the second one is plasticity of like a 20, 30-year-old concept, because it just seems to me that, if you go back 40 years, people said the brain, it's just what it is, and that's it, doesn't change.
I would say that, yes, that I would personally be on the side of that is a myth for sure, that the brain is, not changeable. It seems like through all ages really is what we have evidence of, that the brain changes through all ages of life.
But didn't that used to be like the common wisdom, and then plasticity is a newer concept, or am I just?
I mean, I think it's newer in a concept because it is a change in what we used to think was that, and now we think something different in the scientific community. Gotcha. Yes, definitely. Okay, thanks. So, but go ahead.
But also, you can measure these things now a little better with certain imaging techniques, and you can do mouse models, and they've actually shown that like for instance in mice, they've shown that they've grown new neuron connections with exercise, and which can help prevent Parkinson's or some of these conditions. And so they've proven that in animal models. It's pretty hard to prove that in humans because it's like we're not digging in your brain and doing autopsies on people who are still living, but the concept applies that mice can do it. We're probably going to be able to do it. I know that concept doesn't apply for everything, but that theory still holds true. And yes, neuroplasticity does happen after strokes, at any age. So your ability to have plasticity might be less as you get older, but you definitely have that, even with injuries like that.
Yeah, and there's lactate, hyperbaric oxygen, some of these other things. Even as many of you know, even the kind of psychedelic compounds are being researched for some of this type of stuff. So again, there's a lot of stuff that's sort of in the pipeline here to bolster that. But again, there's a lot of things we can do outside of that. Just again, pushing yourself to learn new things, or to do brain games, or to move in new ways, etc. Right? Also increases neuroplasticity, and I think that's really important, because sometimes we'll hear a term like that and say like, oh well, then mushrooms are the answer then, right? Those increase neuroplasticity, so I should just turn to those. And again, while many of you know I'm a big fan of psychedelic medicines, it's not the answer for everything, and you really want to focus on the things you can do. So I'll just kind of make a comment there, because I know a lot of you or here is my patients, and we have some things here in town that are available to us. That can be a part of this. My message is not that, that can't be a part of this, but just, realize that this is a more complicated picture, and you have to bolster that with all these other things. It doesn't replace everything else we really focused on. So is what I'd say about it. Dr. Krause?
Yeah, no, I don't disagree with that.
Yeah. So, yeah, thanks again for being here. And I think we will sort of call it a wrap up unless we have any other questions from the audience.
Okay,
Yeah.
I have one, just to revisit what one of you guys was talking about with regard to remembering what happened 40 years ago.
Sure.
Crystal clear. But, I'm in my bedroom and I walk in the kitchen. I can't remember why I went in there. Unless I pulled my hand up because I know I'm gonna get something off this shelf. I mean, I walk around like that and my kids are going, they give me the parade with it or whatever, because I'm just standing there doing that. But that helps me get to what it is. And then eventually I'll remember it. But I don't know what you guys do, but like, if it's something that I want from a lower cupboard down here, or whatever it is, or I just go, whatever, I'm going coffee cup, 3 or 4 times as I get into my kitchen. Do I have more or less to worry about if I can remember this old stuff, but can't remember things that are happening 15 seconds ago or yesterday at lunch or whatever was said?
I mean, it sounds like to me, I think Dr. Krause did comment on this, but it sounds like to me that yes, that is something to maybe, investigate a little bit. So,
I think I heard part of it, but just to kind of maybe
short-term memory is more affected. So he was sort of relaying that, yeah, long-term seems to be fine, and short-term memory, there's some things we're noticing that, yeah.
Yeah, but you have to always factor in kind of the elephant in the room of, well, is this normal for my age? A very common statement is I walk into a room and I forget what I was doing in there. And that might be a warning sign too. So don't let me downplay that. But also, like, are things on your mind? Are you stressed?
It's exactly what he just said, sort of. Yeah, I feel like my head is full of stuff. So yeah.
Yeah, is your mind going a mile a minute? Did something happen recently and you're not inputting an actual memory because you're busy thinking about other things? So that's usually my response, to try to tease that out with people, because it's a very common complaint, and you have to wonder if this is something that's leading to other things, like, oh, I got lost driving, or I forgot a meeting, I forgot an appointment. Those are kind of adding up now. Whereas if it's like, I walked into a room, I couldn't remember what I was doing in there, and that happened twice in the last week, but other than that, it never happened, I'd say, maybe something's going on with sleep, or your mood, or maybe starting new medicine, something else may be causing it. So just something to think about.
Yeah, exactly. So
One other thing to think about.
Yeah. Well, so then I would say, again, it's like, so if that is the case, then maybe we add, reflection, meditation, pause, in our lives, increasing awe in our lives, right? Does it go away? Then you kind of have your answer, right? There's this, I think, I would like to give more people permission out there to, do something, like try something out, right? Collect a little data, be a little scientific about it, be a lab of one, right? This is your sort of one sacred life and one sacred body, right? So try something out and, and see what happens, right? A lot of this stuff is harmless.
I love that idea. And the other thing that I'd say is listening to family and friends too, because I think you're self-aware, or all of us are self-aware, and it's something that you notice. But if somebody else is like, yeah, you've been kind of spacing out a lot lately, and I've been worried about you, I just didn't want to say anything, that might be more fuel to it. And then if you wanted to know my approach to this, if somebody came into the clinic, I'd say, again, let's rule out all the other risks or the other things that can mimic this, like stress and sleep. But also we can do a quick memory test in the office, which is something we can do in less than 30 minutes. And it kind of quantifies where you're at as a baseline, let alone like what aspects are you not doing well. So say I did a memory test on you and you scored, borderline normal, but really all of your deficits were in attention, like you weren't paying attention. I'd say, geez, it sounds to me like you're not focusing, and maybe that's ADD, or maybe you're not sleeping well, maybe you're thinking about other things, so that memory test can kind of drive you into the direction of how you want to treat it and investigate. And then obviously if it doesn't get better, you want to do some neuroimaging to make sure there's nothing glaringly abnormal. But yeah.
That's an What memory test do you like to use? Because that's basically what I would do. So.
Yeah, I use a MoCA. I mean, you can also
Yeah.
use an MMSE or slums, but yeah.
Yep. So yeah, and again, I've used probably all three of those in this clinic. So yeah. Go ahead. Another question.
Raises an amateur question that I've had rattling around my brain. Are there multiple methods of storage and access, or is there one basic?
So I think what I would say ultimately is that the memory recall is not like a hard drive. Okay. Is my understanding of this, that like every time you recall a memory, you're sort of almost reliving a memory and sort of firing an old pattern, and so it's almost like I've almost heard the concept of, right, even remembering a memory sort of changes the memory even in some ways, right? But it's very much not like a hard drive. I think does that get to the root of your question a little bit, or
maybe new memories have a different access than old memories, or mediumly old memories.
And yes, I mean,
don't know.
Yeah.
Makes me curious.
How does memory recall work? How would be your KISS method of memory recall?
So
yeah, so that's a hard one.
Let's talk about different forms of memory. There's episodic memory, there's working memory, there's visual memory. There's so many different forms of memory where they are stored in different areas related to different connections. And gosh, you can really go into detail on that, but there's other things that affect memory. Maybe there's an emotional aspect that makes the memory stronger because you were attacked by a shark and you'll never forget that exact moment. So I think there's just so many different ways to say, yeah, there's different areas you store memory, there's different connections and different strength of connections. So yes, to your point of long-term memories being stored separately, yes, that's true. There's kind of a different mechanism for that versus a short-term memory or a working memory item, or some of those other categorical memories, maybe, I don't know. So it's kind of a complex interplay that we still don't understand, to be honest, but it does seem to be compartmentalized differently. And I'll probably have to go, Raman. Thanks for having me, though. I appreciate it.
Yeah. Thanks again for signing on.
All right. See you guys. Thanks.
Thank you. Thanks. I was going to say, sir, that there was a really great segment about different kinds of memories on the show, The Hidden Brain, if you listen to that.
Yeah.
Podcast.
Hidden Brain, Radio Lab, I think also is a really good podcast that has some stuff on.
Yeah. I can't, how do you say that, guys? Shivan? I can't.
Yeah. I'm forgetting his name now, but yeah. I know who you're talking about. Yeah.
Great podcast on The Hidden Brain about,
yeah, and it's
all about memories and how they get stored, and how you store something when you're 20 and how you store something when you're 60 or when you're 3.
Checking another box, which is I can learn in a different way about a different thing and stimulate my.
Oh yes.
Yeah, that's awesome.
He talked so much that I was like, he's a brilliant guy. But,
well, yeah. No.
But man, I listened to it. My wife and I listened to it after I listened to it by myself.
I mean, and I'll say, my resources slide wasn't very robust, and part of what I try to do is connect people to resources. But again, there's so much good information out there, but it's hard these days. And part of the point of me doing these talks is to sort of try to condense, again, what I've seen to be that really makes sense to me, right? So this is my integration of things like podcast, Radio Lab and Hidden Brain and Huberman Lab and the Drive podcast and all these other things, plus medical school and every clinical experience. So anyway, so that's in a day where in day and age where it's hard sometimes to know who to listen to. You guys have trusted me with your trust, I guess, and so this is my way to sort of pay that forward.
Well, after you sent me a couple of videos that Peter Attia did.
Sure.
I did a deep dive into him for a little while.
Sure.
And he's pretty amazing. And then
yeah,
the people that he talks to are also amazing. So
right. I mean, then he's got again access to some of the world's experts, right? It's so and I have again some experts too. So so I'm proud to at least add to the discussion and certainly be kind of a local force here in Canyon. So thanks for being here.
Appreciate it, sir.
Thank you.
Absolutely. Yeah. Thank you guys. I'll stop this recording at least. Thanks again, everyone online.